All right, today we are not just talking about a medical condition. Nope. We are going to be detectives. We're going to crack a case, piece together some really baffling clues, and unmask a single hidden culprit behind a whole bunch of health problems. So welcome to the case of the iron overload.
Okay, so let's dive right in. You know, like any good mystery, this one starts with a bunch of weird, seemingly disconnected clues. A collection of symptoms that when you first look at them, they just don't make any sense together.
So this is the big question, right? What in the world could possibly connect someone's skin turning a bronze color with their joints aching and their liver starting to fail? I mean, you'd think these have to be three totally separate issues, but as we'll see, they're not. They all come from the same place. And this is what makes the case so tricky. The clues are all over the map. You've got serious liver damage, that very distinct bronze skin, even diabetes because the pancreas is in trouble. Then it can spread to the heart, and it causes this really specific kind of arthritis. And maybe the biggest clue of all, this whole thing usually doesn't even show up until someone's over 40 years old. The pieces of this puzzle just don't seem to fit.
Okay, we've laid out the evidence, we've seen the damage. So what's the one thing tying all of this together? Now, before I reveal the culprit, let's talk about what it's not. This isn't some virus you can catch, and it's not something that happens because of what you eat or how you live your life. No, the answer is way more fundamental than that. The culprit is iron. Yeah, the exact same essential mineral your body absolutely has to have to work properly. But in this case, the body is getting way too much of a good thing. It's a total overload.
So, the official diagnosis here is hemochromatosis. It's a disorder where the body's internal thermostat for iron just completely breaks. Instead of taking in just what it needs, the body starts hoarding iron, packing toxic levels of it into the liver, the pancreas, the heart, the joints, the skin, which, when you think about it, connects every single one of our puzzling symptoms perfectly. But why? Why would the body start doing this? Why would it hoard something it's supposed to manage so carefully? Well, the answer isn't a behavior. It's a blueprint. It's written in the genes. The best way to think about it is like this. Your body has a genetic gatekeeper. It's called the HFE gene, and its job is to control how much iron gets absorbed from your food. Normally, this gate opens just enough to let in what you need, and then it shuts tight. But in hemochromatosis, there's a genetic glitch that basically busts the lock. The gate is stuck wide open, and iron just floods in, day after day, for years and years.
And scientists have pinpointed exactly where this faulty switch is. It's that HFE gene, found on chromosome 6. And the specific error, in the vast majority of cases, is a single mutation called C282Y. This one tiny typo in the genetic code is the root cause of this entire medical mystery.
So knowing the genetic cause is a huge piece of the puzzle. But how do doctors actually solve the case for an individual patient? Turns out there's a pretty clear logical path they follow to get the diagnosis. The whole diagnostic process really boils down to three main steps. It kicks off with a simple blood test, basically to follow the iron trail in the body. Then the investigators, the doctors, look for very specific physical clues. And finally, the case gets closed with that definitive genetic confirmation. So step one is the blood work. Doctors are looking at two key markers here. First is serum ferritin, which tells you how much iron is being stored in the body. The second is transferrin saturation, which shows how much iron is actively circulating in your blood. In hemochromatosis, both of these numbers are going to be way up. The blood is practically screaming that there's an iron overload problem. Next, the physical exam. And this is cool. There's one sign that is incredibly specific. It's a very unique type of arthritis that shows up in the main knuckles of the second and third fingers. If a doctor suspects something, they'll get an x-ray of those joints, and they're looking for the key evidence, these tiny bone spurs that are described as hook-like osteophytes. It's like the condition's classic calling card. And finally, to close this case with absolute 100% certainty, you have the gold standard, the genetic test. This test looks specifically for that C282Y mutation on the FHE gene. If it's there, well, mystery solved. Okay, so we've got a complex genetic disorder that causes the entire body to overload with iron. You'd think the treatment has to be some kind of futuristic gene therapy or a super complex drug, right? Well, the solution is surprisingly simple, and it's actually been around for centuries.
So just think about it for a second. How do you actually solve this? How can you physically remove a mineral that's built up in pretty much every organ in the body? The problem seems huge. The answer is one word: phlebotomy, which is just the fancy medical term for bloodletting. Seriously, the regular controlled removal of blood, pretty much exactly like when you go to donate blood. The logic behind this is just beautifully straightforward. Most of your body's iron is stored and transported in your red blood cells. So if you've got too much iron, the simplest way to get it out is to just remove the very thing that's carrying it around. By regularly taking out blood, you force the body to use up its extra iron stores to make new red blood cells. And over time, you bring those toxic levels right back down. And that just leaves us with this final, kind of fascinating thought, doesn't it? Our case started with all these complex symptoms. It led us to a very specific genetic mutation discovered by modern science, and it all ends with a treatment that's been practiced for literally thousands of years. It just makes you wonder, why does such a simple, ancient technique provide such an elegant solution for such a complex, modern genetic problem?